People are the most important factor in making medicines and the other products which adopt the principles of cGMP, of current good manufacturing practice. The GMP guides issued by regulatory bodies require that detailed hygiene programs should be established for personnel health and hygiene practices. These practices must be understood and followed strictly by everyone whose duties take them into production and controlled areas. It's central to those requirements that hygiene programs should be promoted by management and discussed during training sessions. Let's just recollect why GMP and all the precautions and procedures are so important when making healthcare products. Remember that with virtually all products you can buy, it's possible to test them yourself or to return them if they're found to be faulty. With medicines, that's just not possible, because we can't test these products without destroying them or making them unusable. It falls to every single person concerned with their manufacture to be responsible for their own personal hygiene and cleanliness, not just for social reasons, but to comply with GMP as well. We go to great lengths to ensure that the products we make are free from contamination. Protection from physical contamination in the air is provided by controlling the production environment by using air handling systems. In sterile areas, for example, the air is controlled so that all particles larger than 1/100th of the diameter of a human hair are filtered out. We clean production machinery carefully for minute particles and chemicals, for microbial contamination, as well as applying very strict procedures to all ingredients, components, and packaging materials. To make certain that dirt from outside is not carried into the workplace, we change into plant clothing as soon as we arrive at work, although the actual clothing protocols will vary dependent on the type of production area. So, GMP takes care of the environment, of production equipment and its maintenance, of the materials used in the product, of the clothing used throughout the plant, and because we represent one of the great danger areas in GMP manufacturing, it takes us and our personal hygiene into account as well. But what dangers do we present? There's the dirt and chemicals that we carry about on our person. There are the particles we shed, in the form of skin flakes which come off all healthy humans every day, literally by the million, as our epidermis replenishes itself. And there are the germs, or microbiological organisms, which colonize in and on the human body. It's actually the germs which cause the most concern, because if they contaminate the products we make, they can cause infection in the patients we're trying to cure. It's natural that our bodies are host to countless millions of germs that pose no threat at all to a normal, healthy human. It's only when those germs infect the person we're trying to cure, a sick patient with reduced immunity, or invade the body through a cut, for instance, that they pose a problem. So where do we start taking precautions to minimize any compromise to the manufacturing environment? As a general rule, the first thing is to consider what types of contamination we've been in contact with since last being at work. Have we done anything, or been anywhere, that might cause problems? Now let's look at the body in detail, any body, to see what matters. Let's start at the top with the head. It's not difficult to imagine that a head of hair, no matter how much or how little, will be a happy hunting ground for tens of thousands of microorganisms, as we can demonstrate by contact plates which illustrate the presence of bacteria. And that's true even after the hair is thoroughly washed and dried. So apart from washing the hair frequently, it's essential that correctly designed, and even more important, correctly fitting head covers are worn. Beards and moustaches are also hair, and beard covers must be used at all times. Other parts of the head which can signal danger are the nose and the mouth. Both are prolific breeding grounds for a wide range of germs, some of which may cause diseases no more serious than a sore throat. Others can be much more dangerous and cause septicemia and other serious infections. The risks of causing contamination from the mouth are almost in direct proportion to its activity, with the least risk associated with normal breathing, with increasing threats coming from shouting, coughing, and sneezing, which is the most dangerous because of the droplets which are expelled at great velocity and from which the liquid will evaporate, leaving tiny dust-like particles to settle onto surfaces and the floor. For obvious reasons, a person who sneezes or coughs should move well away from the work areas, unless it's more dangerous to leave the equipment unattended at that moment. This is the reason why effective face masks should always be worn in areas where sensitive products are produced. An important factor about contamination from the nose and the mouth is that it nearly always goes where we're looking. Masks don't stop the contamination, but they do absorb a certain amount, and the air is deflected away from the workplace. Incidentally, someone suffering from infected teeth or gums should make certain that they brush them regularly so that the microorganisms are kept to a minimum, quite apart from the particles that are dispersed from the mouth after eating. Good oral hygiene is very important. This, of course, highlights the need for proper environmental cleaning to be undertaken, because inadequate or inappropriate cleaning causes contamination when these bacteria-laden particles dry and are redispersed into the air during, for instance, the cleaning process itself. Then there are the eyes, which are self-lubricated and can be a source of inflammation and contagion. For some people, they're a source of skin problems. Ears are also in this category and must be kept clean. And both ears and eyebrows are sources of contamination by being rubbed by headwear, by masks, by spectacles, and worst of all, by conscious or unconscious mannerisms such as rubbing or scratching. Cosmetics and makeup present two further problems. Let's look at why. The first problem is technical and arises because cosmetics consist of millions of individual particles, often held in viscous or greasy base materials, which bind and hold particles and microorganisms. These are then dispersed into the atmosphere either by abrasion from clothing or by our own actions, just as and as well as the particles and liquids that are a natural part of our bodies. That's the technical problem. The other is really an emotional problem and exists because some people tend to feel undressed when not wearing makeup. The general rule is that makeup presents an avoidable contamination problem and should not be worn at all. However, in practice, the rules for wearing makeup will be dependent on the risk of exposure to each specific product and in every specific work area. For example, in sterile production areas, no makeup should be worn because the risks and effects of contamination are high. On the other hand, the risk involved with a contained, high-speed, automated production line can be viewed slightly more leniently. After the head, the body. The body is a large breeding ground for germs, with some parts, the warm and moist areas, being better nurseries than others. It goes without saying that in terms of personal hygiene, every part of the body must be kept as clean as possible. This means that the need for regular washing and bathing is of paramount importance. A bath can be both cleansing and comforting, but unfortunately the water and suds that we wallow in can form a soup which will recontaminate the body. Showers are preferable and should be used whenever possible, as the dirt and debris is washed away. And last, but by no means the least, hands. It's our hands that permit us to manipulate, to sense, and to control. But when we're working to the principles of GMP, they can be major sources of contamination. We use them to scratch ourselves, to carry possibly contaminated items, from which they can transfer the contamination most effectively. They harbor dirt, as well as the harmless and the very dangerous germs that live on us and in our urine and feces. This highlights the need to keep hands scrupulously clean at all times, and of course we can monitor how effective hand washing has been. Special attention should be paid to fingernails and cuticles. Sometimes washing in ordinary soap and water is not sufficient for some working environments. Combined soap and disinfectant or bactericide may be required. It's worth noting that healthy human skin has some natural bactericidal properties, and under some circumstances it may be better not to scrub the palms of the hands and fingertips, as this can sometimes remove skin flakes and expose colonies of germs under the skin, which wouldn't be a problem if left alone. This is a matter where the procedures will be decided at each plant. It's important that hands are dried well, and that the method of drying doesn't itself create contamination or pass it from one person to another. Each organization decides which system it uses, but the best options are either well-sited warm air dryers, ideally with filtered recirculating air, or disposable towels made from low-particle shedding paper or fiber. If continuous cabinet towels are installed, it's essential that after use, each user must pull through a clean section of towel so that the next person is not presented with a contaminated section. But just washing hands is not enough. cGMP guides, without exception, recommend wearing suitable gloves to avoid both contact with the product and any machine part itself in contact with the product. Jewellery is another factor in personal hygiene, either because of where it's worn, because it harbours particles and greases, or because it'll create abrasion and cause contamination. Jewellery is always the subject of company policy and should be removed and stored as directed. Let's examine the other aspect which comes under personal hygiene, your health. Normally, everyone is examined medically when first joining the company. These examinations are often repeated throughout your employment. For example, it's routine periodically to take nose and throat swabs of those working in sterile production areas. It should be noted that you have a personal responsibility to inform the company of any change to your state of health. And in fact, it's usually a condition of employment that the company has a right to insist on a medical examination when advised of such changes. We can all understand why anyone with an infectious disease or with an open cut on an exposed part of the body should report it to their supervisor immediately. When this happens, we can all understand why it's not possible to work directly on medicinal or other sensitive products. On these occasions, and until the condition is healed, work is nearly always provided in areas where there's no risk to the product. But remember, the organisms which caused the problem are not always eliminated from the body at the time of clinical recovery. So, after recovery from certain illnesses, the rules often call for continuous monitoring to establish that the person is completely clear of infection before being allowed back into the production area. Of course, smoking, eating, chewing, and drinking are not permitted in production areas and must be confined to designated places outside the workplace. And that's it. Those are the major aspects of personal hygiene as defined for working under the principles of cGMP. Let's review the factors which contribute to personal hygiene.
cGMP requires that everyone is trained in personal hygiene. Remember, medicines must always be made correctly. People are one of the great contaminators. Skin flakes cause contamination. Bacteria and microorganisms live on dead skin flakes. Germs which live on and in us can cause infection in patients. Each person is responsible for their own hygiene and cleanliness. Hair must be kept clean. The head must be properly covered. Beards and moustaches must be correctly covered. The nose and mouth are both danger areas. Don't shout. Try not to cough or sneeze. Always wear correctly fitting masks. Don't rub your eyes, ears or nose. Be aware of dangerous mannerisms. Makeup is a serious contaminator. Wash regularly. Showers are better than baths. Hands are major contaminators. They transport contamination, and they also harbour contamination. Hands must be kept totally clean. Pay particular attention to cuticles and nails. Jewellery should not be worn. All personnel should be medically fit. Smoking, eating, chewing gum and drinking are prohibited in production areas.
Remember, for those people who work making medicines or any of the other products where the principles of cGMP are used, then each person accepts the responsibility to work and to behave in the best possible way. Think clean, dress clean, work clean, and keep clean at all times.